Halito Chukma Sahaju. Thank you, Lisa. My name is Lauren. I'm a citizen of the Choctaw Nation of Oklahoma, and I'm really happy to be here with you today. I think that Tanya is having some internet trouble, so she may not be able to join us, but if she happens to hop on, then I'll grab her. So I'll hand the baton to Josie to introduce herself.
Hi, my name is Josie Garnie. My native name is Boyana. I'm Inupiaq, but my name is after my great-grandma who was Chukchi from the Russian side. My parents are Helen Elveq and Joseph Garnie, and I'm related to the Kakaruk and Topkok families as well.
Thank you, Josie. And as I was preparing to start these slides today, I was trying to locate which Indigenous tribes to acknowledge for caretaking the land. I am joining from University of Michigan, where my academic training is. I know Lisa's there too, and that's the lands of the Three Fires people. But we're also doing work that we're presenting today with Yupik and Inupiaq folks, and so they're also important to acknowledge in this work. And I'm joining from Tulsa, where we have the Cherokee Tribal Nation and many others like the Osage, the Wichita, the Caddo, the Muskogee Creek who have been moved here, as well as the Greenwood District, which is also known as Black Wall Street, where the seeding for that land and money came from land allotments to Black freedmen. So it becomes hard to unravel the ways that we're all connected when there's so many Native people in the room. So I just want to acknowledge that all of us are on Native land, and to also acknowledge the wonderful display of action that has been put forward here today of pushing back against deficit narratives that really take some root in times that land were taken. I'm overwhelmed by how many beautiful examples of honoring Native knowledge and centering Native people as incredible thinkers and scientists that we've seen today. I think probably among the speakers, I'm one of the newest. I've only been working in this area for 5 years, so I've had the incredible benefit of reading work about all of these projects, including PC Cares, for the whole time that I've been coming up as a suicide researcher. And it's just an amazing opportunity to be in a community of Indigenous researchers and allies that center us as being the leading edge. So I think it's important to acknowledge that and say yuck to all of the folks who have come before. Okay, so I'm going to be sharing today about PC Cares. This is a research intervention that's been done in collaboration with Yupik and Inupiaq folks in Northwest Arctic, Alaska for between 15 and 20 years. I've been working on it for the last 5 years. And some of the work we're showing is from pilot and some is from an R01 that we're working on now. And you can see across the slide, we have an amazing diverse team. There's many others besides us to think, like our statisticians and folks like that. But me in the middle, Josie Garnie and Tanya Kirk, we're planning to present today. And as I said, Tanya's internet is going in and out. I think this is a problem that's very familiar among the folks on this call. We have infrastructure issues a lot in Indian country. And Josie is kindly joining us to help with the Q&A because we think there may be some important questions that come up that she'll be able to speak to. I'd also like to just note the many organizations, tribal organizations and universities that have contributed to make this work possible in the last 15 to 20 years. This is an incredibly huge community effort, and I think all of us feel honored to be a part of it and working together. Okay, next slide. So I wanted to start with addressing context here. As I said, we're working in the Northwest regions of Alaska. We know that suicide is the leading cause of death for American Indian and Alaska Native young people between the ages of 15 to 29. In some Alaska Native villages, the youth suicide rates are up to 18 times the national average. And the PC Cares intervention is currently conducted mostly in the kind of northwest portion of the map, which you can see has some of the higher suicide mortality rates. But speaking generally, suicide rates really vary between Indigenous communities across North America. Some of them have lower than average rates, but at the aggregate level, the rates are higher than for any other racial or ethnic group. While the all-age suicide rates have gone up across the US in recent decades, in Indigenous communities, we've seen especially steep increases. I know this has been addressed several times today, but research suggests this could really have to do with experiences of marginalization and discrimination, growing up in communities where the crunch from climate change and colonization has made the future of Indigenous communities sometimes feel uncertain. So when we're doing suicide prevention work, we're also fighting back against many different forces that are coming together to oppress Native communities. Next slide. Another thing that we hold in mind as we're working on PC Cares is common misconceptions about suicide. I think this image on the left does a really good job of highlighting some popular culture repertoire around suicide. Many people associate it with being something really dark that's kind of deep inside the individual and likely the result of chronic and debilitating mental illnesses, which needs to be addressed by experts like therapists and clinicians. And this image is accurate in some cases, but also research shows us that a lot of the time, the reasons for suicide and the type of individuals who contemplate suicide look really different from this stereotype. In fact, we know that half of suicide attempts happen among people who have never been diagnosed with a mental health condition. We sometimes see studies that report, very high numbers of diagnoses that are associated with an attempt, but those are often done off of electronic health records type research, where when someone is admitted, in order to be billed for care, they need to have a diagnosis. So if you look at studies that are kind of a few steps removed from that emergency admittance, we will see that a lot of people do not already have a diagnosis for a mental health condition. We also see that about 2/3 of people who attempt suicide are not receiving consistent mental health care. And this is from a meta-analysis of about 40 studies that look at that over the last few decades, although many of them do have contact with primary care. We also know that about half of suicides are very impulsive. And even when people are accessing care, we find that we're still trying to learn how to identify who is in imminent danger. So these last couple of bullet points are from a 2016 meta-analysis by Matthew Large and colleagues. And what they found is that all kinds of clinicians here, not just therapists, are not always great at identifying who is in imminent danger. So they looked at studies going back over the last 50 years and found that 95% of patients that had been classified as conditions as high risk did not die by suicide, and about half of the suicide deaths were among patients classified as low risk. So while there is still important amounts of efficacy happening with screening, it's not necessarily the whole picture. Next slide, please. And we think that some of the context for these struggles has to do with the duration of suicidal crisis. It can really be very short. Interview studies of survivors of nearly lethal attempts show that many people report they think about suicide for only a few hours beforehand. One study in particular, Simon in 2014, showed that only 13% of people who went on to attempt thought about it for more than one day. So about 70% of that sample reported they thought about it for an hour or less. So this gives us some insight into why it might be really hard to predict and why expanding our focus from the idea of suicide as a result of a long-term debilitating mental illness requiring only expert intervention and pulling in what we can do in our local environments before anyone is showing signs of suicidal intent to take action can be really important in reducing risks in a moment of impulsive despair. And I've listed out here some of the kind of environmental and interpersonal things that are correlated with these impulsive suicides, like the breakup of a relationship or the death of a loved one. Next slide. So kind of holding those factors in our minds, we come into PC Cares with the question of how can we partner with Alaska Native communities and families to prevent suicide? Moving from a risk only to really expanding. And I want to reiterate, this is not about, oh, risk detection is not important, but kind of what Dr. Gon was saying earlier today, that multi-level interventions, which are bringing together many different ways of combating suicide, is important. So expanding our understanding to think about how in the local community we can work together, and especially to be working with informal helping systems, as well as the behavioral health services. These are the kind of driving forces for our PC Cares work. Next slide. And so like many, I don't want to say many, I think all of the people who have presented today have emphasized this point, that Indigenous community is incredibly important for prevention. And we use modern language now to say it's a protective factor, but truly it's the heartbeat of our communities. And so when we come in and ask how we can partner and do things that are upstream, obviously this is one of the most important pieces that to center. We know that Indigenous concepts of resilience understand our strengths when we have a strengths-based kind of approach, understand our strengths as not coming only from ourselves as individuals, but also coming from our social relations, our collective identities, and all of the things that are in our environment. And so it's a match between our individual resilience and our environment and our relationship with ideas and other people and more than people beings that come together to make us resilient. And research really reinforces this approach. We know that strengthening social and emotional support is protective against suicide attempts. And we've really seen here today some of the most successful suicide prevention efforts that have happened in Indian country are using this lens. So when we talk about innovative practices, this is the innovation. It's trusting that communities hold the knowledge and that the relationships that we have with each other are a central piece in moving forward with suicide prevention. Next slide. So we were going to have Tanya speak on this side, and she does such a good job that I'm going to make an effort, make an attempt. With PC Cares, we try to come in with an idea of balancing different ways of knowing. So bringing in research information about suicide prevention. For example, on this far left-hand side, you can see kind of a line graph. And this is a result of some research around adolescent suicide rates and seasonality in certain parts of Alaska. Many people would assume that the dark winter days are the times that suicide becomes a problem because it's gloomy and it's dark. But research shows us that in the summer months is actually when young people especially have a peak in suicide in some regions. So bringing in this kind of information and talking through, having it be light 24 hours a day and talking with community members about what they think that might be driving suicide rates in that environment is a good example. And then on the right-hand side, you can see some pictures of that represent Indigenous, local, and relational knowledge. So PC Cares is a series of learning circles. And when we do these learning circles, we're trying to bring these two ways of thinking about the problem in conversation with each other. Next slide, please. We're also thinking with that about, again, with the multi-level kind of approach, about bringing community members as their whole selves. So we do invitations that are targeted for certain community stakeholders like law enforcement, school staff, behavioral health staff, but we also invite in parents, aunts, uncles, friends, and of course, many people are both of these roles at the same time. So we bring this invitation to join a PC Cares Learning Circle and invite everyone to show up as their whole selves, and then to participate at the different levels that they're connected with as that becomes accessible and makes sense for them. And I think on that previous slide Tanya was going to do, I probably should have said, we usually do a series of learning circles. So this last year, we did a series of 7 learning circles. We commonly time them out to have 1 learning circle every month. So we're building community relationships over time as we're learning together. And we end up having a few months of building relationship, learning, and then moving forward to see after the learning circle we've done how we want to take action as a community. Okay, next slide. Okay, so the structure of a learning circle tends to start with preparing the space. The facilitator does a welcome. We have blessings, prayers, or readings. These are often done by local elders. And then we go through group agreements and we discuss how to talk safely about suicide. So not sharing details about how it happened, speaking from our own experience. Often Josie Garnie actually does this, and she does such an excellent job of giving different kinds of examples depending on who's joining with us. This is a really critical part of Learning Circle. Then we discuss, what did you do with the information you learned in the last Learning Circle? Because again, these build over time. We may have 5 modules, we may have 7. So look back at what we talked about last month, and then think about what we've done over the last month to use that information. Then we move into a what does the research show section, or what do we know section of the Learning Circle. We try to keep these as bite-sized pieces of information. So that little graph on the previous slide that shows the seasonality would be one bite-sized piece of information. We also talk about lethal means restriction in one of the learning circles. That's a bite-sized piece of information, that storing your gun and your bullets separately, or doing something to make your gun about 10 minutes more, less accessible to get to in a moment of impulsivity, that can save a life. So we hone in on something. We don't PowerPoint people to death. We hone in on something that takes 5 or 10 minutes, and we share that. We try to keep the information as locally specific as possible as well. So sometimes we pull from like the Youth Risk Behavior Survey. We talk about things that young people specifically in that region have reported in terms of social support, things like that. Then we move to the larger portion of the learning circle, which is what do we think? And this is a facilitation of small group discussion on how the information that's been shared applies or doesn't apply to participants' community and their personal contexts. So this is a really important space for doing that, bringing in Indigenous and local knowledge, and to have people make sense, interpret, and maybe reinterpret the information that's been shared as they're thinking about how it applies in their local context. Then we have the what do we want to do section. And this is group discussion and reflection about what communities and individuals can take away from the session and actually do in their local community. And then lastly, we close out with prayers, songs, meditations, or other selections. And again, this is often led by an elder. Okay, next slide. So here is one example of the what does the science know, or what do we know, little bite-sized piece of something that we've recently been using in learning circles. This is a figure that's based on data that we collected actually in our baseline social network survey for the first year of our PC Cares intervention. So we asked questions about sources of support for general wellness, like in the last few months, have you talked to an adult about what's happening in your life? Has someone taught you something about your culture? Has an adult made you feel special by spending time with you? After we ask these yes or no kind of questions about what a young person has experienced in the last few months. I think this graph is for between the ages of 15 to 29. So after this young person has responded yes or no to these, we ask then, who have you been doing that with? Has it been a grandparent, a parent, a friend, a service provider? And they can check as many of those roles as applies. And then we also asked questions about frequency and duration of that. So here we're just presenting, and we're using in our learning circles the yes or no to these questions, and then who the young people had identified. And one thing that really comes out whenever we are showing this with community is how small these service provider bars are. Some of this is a reflection of who is in the community. In many of these rural villages, there's only one or two service providers. So that could be a big part of the reason. But looking over and seeing that parents, grandparents, close friends are really the champions of support. And they're the folks that young people are coming to for support and for general wellness is an important takeaway. Okay, next slide, please. We also ask these questions, some items that are related to support in times of stress. So this is a graph we usually show right next to the previous slide. And this was responses to the same survey, but for items like, when I was down, someone reached out to me, or when I had a problem, I talked to an adult about it. And you can see here, very similar trends, but the close friend category really skyrockets up, and we see the parent category shrink a little bit. So it's interesting to think together with the community members about times of stress, who is supporting those close friends that young people are turning to in times of stress. And this is something our community partners usually pick up on right away, and we have discussion about what we can do as a community in terms of support on that. Next slide, please. And these are animated, so you can just click through until the slide is full. Perfect. So I want to share a little bit about outcomes, because I know evidence is important here, and understanding how the intervention is working is important. So we're going to share about that. From our pilot outcomes, which happened, this pilot happened in 2015 to 2017. It was done all in person, and we trained local Alaska Native facilitators to lead the learning circles. We found pretty great participation. We had 535 attendees, 376 were unique. We found good satisfaction, fidelity, and accuracy. For learning outcomes, we did find gains in knowledge, skills, and belief, and especially around knowledge, skills, and beliefs to do with community of practice. So we wanted to know if participants are really strengthening their relationships and indicating that they're doing things to prevent suicide that's in collaboration with other people and working together with other people. We looked at behavioral outcomes and found some really good effects with taking action over the months after the learning circles. And again, we looked at social network outcomes. So this is a really exciting finding that we notice all of these knowledge, skills, and behavior changes for people attending learning circles, and almost in a dose response kind of relationship. For the number of learning circles they attended, there was better and better outcomes. But we also found through social network analysis that friends of people who were attending learning circles were reporting changes in knowledge, skills, and behavior. So a really exciting indicator that there's some community mobilization happening around suicide prevention in these regions. I know I'm skipping over this pretty quickly. We have publications on outcomes for this, which you can find at our website, and I'll show that at the end. But this is just a quick overview of the outcomes we found for the pilot. Next slide, please. Oh, and here's some village member comments from that time. These are really exciting to read after you've been in the community doing the teaching and finally you're done, and you hear people say things like, if we want things to change, we need to step up and do this as a team, and it'll get better when we are working together. It's a good thing that we're getting together today. I'm not alone, and we could all do this as a community, for all of us to heal and for everyone else to heal also. So these are really promising kinds of things that we're hearing from community members participating in the learning circles. Next slide. So now I want to shift to some outcomes from the more recent iteration of PC Cares. This is something we did virtually in the school year of 2020 to 2021. In response to COVID-19, it was not really feasible for a lot of traveling to be happening, either to train facilitators, and in some cases in the villages, it wasn't feasible for facilitators to be meeting. So we shifted our implementation strategy to work with the schools where we had the most stable internet access. And that meant that our attendees also shifted. So we ended up going from mostly Alaska Native community members that were coming from all across the community to this new group that was being connected through the schools and ended up being majority teachers and about 55% white. We still had really great attendance for these. You can see our baseline survey results, and it's pretty in alignment with what we were seeing in terms of attendance. Look at learning school surveys. So these are some of the process indicators of how that went. Next slide, please. And here's some of the outcomes at the end of that first year that we found in our follow-up surveys. About 90% of people reported working with others to increase wellness in their school community. 90% agreed they have more ways to promote wellness after the PC Cares session. 87% said their relationships with people in this session are better because of the discussions. 72% said they spoke up about what the school can do to reduce the risk of youth suicide. So again, here, we're still crunching all the numbers on this phase of the intervention, which was delivered virtually, but the preliminary data is looking very promising. Next slide. And again, similarly to pilot, we're seeing somewhat of a dose-response relationship in terms of number of learning circles attended. So over time, as people are getting into the curriculum and experiencing more and more of these learning circle sessions, they're reporting more and more doing things like speaking to someone about how to talk safely, or encouraging someone in the school to have a response plan for what to do if there's a suicide death. Next slide. And here's more preliminary data on this. So we asked questions about promoting wellness and helping to prevent suicide. We've heard across a few of the presenters today this theme of we're not just focused on preventing death, but building a life that we want to live and building communities that we want to live in. And so our items for the PC Cares intervention also reflect this understanding that it's important to reach out to people when they're struggling, but it's also important to just do things that are promoting life. And this is a little sample of questions that range across that spectrum of things. And we see some really exciting increases in what people are reporting. So this is asking, in the last few months, have you found ways for a child to give back to their school, community, or family? 9% increase. In the last few months, have you quietly listened to a youth who had a problem, reflecting back to them what you heard? 8% increase. This item has to do with our learning circle listening well, where we coach people to, practicing without giving advice, which can be really hard to do when you're interacting with a young person who's going through a hard time or experiencing grief. So we're really encouraged to see these preliminary outcomes where people are reporting increases in taking all of these different kinds of actions. Next slide. And then we really want to highlight these items where there's an increase in collaboration. Again, we believe that building a community of practice and mobilizing the entire community to think about what can I do right now to address the issue of suicide locally in my community, and what can I do in collaboration with other people? That's really the driving force of this intervention. So we wanted to highlight these items about working with others to increase wellness. We're seeing an 8% increase in our follow-up, and working with others to prevent suicide. So that theme again, increasing wellness, building a life worth living, and preventing suicide. Working together to do that. People are doing that more. And what more can we ask for? We're excited to see it, and we're happy to crunch the numbers more and be able to share more granular level results. This focus group quote is really great. This is from one of the white teachers that participated in the program. And they said, truthfully, I was very impressed because it really brought a lot of the villages together with the suicide prevention, and it was more focused on the villages. And here they mean the village communities. So not just focus on the school itself, but the broader community. I was really grateful to see that it was directed to that subject and helped us teachers really be able to find a plan and focus on a plan for not only the school, but the community as well. Next slide. On a closing note, I just want to end again with emphasizing this idea of communities of practice. This little house graphic on the right is another example of one of the bite-sized pieces of information that we present in the learning circles. This is all about lethal means restriction and looking through your home to find ways to reduce access to firearms or medications, install light blocking blinds, doing things like that. So it's important to give people this information about what they can do in their homes, but we believe it's even more important to make space for people to come together, make sense of that information, interpret and reinterpret that information, and make connections with each other so they can go forward and support each other in making changes in their community. Next slide. And that is it. So big thank you to Lisa and everyone on this team. We have so many people to acknowledge here. I am quite sure that this is not all the names that we should maybe have on this slide, but without these folks, PC Cares cannot exist. So yeah, Koki, thank you. And I think we're ready for questions.
Thank you. So I see that we have about 2 minutes, and we haven't received any questions, but my eyes are open for them. And I guess what I'd like to do is just to see if Josie wants to add anything about what's important about what's happening with PC Cares, or what's important for suicide prevention from your perspective.
Yeah, I've worked in behavioral health here for our health corporation for over 25 years. And this is like one of the first programs that gives us a small bite-sized piece of information, like the research part. And then it asks us what we think, like local Native people, what we think and how we want to use it. And that piece is just as important as the research. It's not a program that's just telling us what the research is and then telling us what to do. It's letting us do it for ourselves. And I think it takes a lot longer. So like the learning circles can be up to 3 hours long instead of a quick, little half-hour activity. But the extra time is really worth it, and it makes it a lot more meaningful, and it makes me feel a lot more valued as well.
Thank you for that, Josie. So we are coming right up on 4 o'clock. I see we have 42 seconds left. This was a great presentation. I'd love to see all of the nuances and the ways in which both projects that were presented, both Dr. Brocky's and PC Cares, really attended to local meaning systems and built things based on what people thought were most important. And, balance between creating futures and hopeful ways of engaging with young people, and worked to reduce suicide risk. So I think both of those things we've heard really clearly.